Hello, I'm Dr. Drossman.
Hi, Dr. Drossman. Mrs. Smith.
Ms. Smith,
Davis.
nice to meet you.
Yeah.
Well, how can I help you? Am I supposed to not know you, by the way? How to roll? Am I not supposed to know them? Okay. How can I help you?
Go ahead and tell him what's going on.
Well, I've been to a lot of doctors, Dr. Drossman, and nobody's been able to help me. I have really severe pain. It's been going on for a very long time, and I just hope that something can be done. I also have diarrhea. I have to go to the bathroom all the time. It's creating all sorts of problems, for me, for my...
Yeah, and for, the rest of us too, because, nobody's able to do anything about this for her, and so it's just over and over again. She's always complaining, and we have a lot of things going on. Our kids, special needs, it's just a mess. We need some help.
He's right. We do need help, and I tried a lot of medicines. I really don't know what to do anymore. So I hope you can help me out.
Okay. I have to make a decision now. All right, so I'm in a situation where I've already gauged the fact that this is an environment, a family environment, where she's taking a rather passive position. Hands are like this, sitting like this. Lips are somewhat tightened, which could be another emotional message. He's got his arms crossed. He shows anger, some level of disdain. So I'm going to have to figure out, how am I going to deal with this? Okay. So, it sounds like this is affecting both of you. It must be hard for both of you, I would imagine.
Yeah. Yeah, it is, because, she can't do hardly anything around the house. And, I don't know, it's like, we need some help. And I just can't understand why medicine can't take care of this problem. What's the big deal? She's got diarrhea, she's got some other stuff. Just give her some medicine and take care of it, so we can get on with our life. We've got a lot going on,
Right, and I understand that because you want to get going with things. And I think first I'd like to get a little bit better history and understand more about the symptoms from your wife.
Yeah,
okay?
Tell him what's going on.
Okay.
Well, I'm out of work, and all I do all day long is basically I have to run to the bathroom all the time.
Mm-hmm.
If I start doing something, wash the dishes or try to do something, here I am again going to the bathroom. And there's cramping and there's pain, and I can spend up to half an hour in the bathroom. And I can't be with my kids, and I certainly can't work, which is a problem.
Okay, I'm going to abbreviate this. Well, I could see from the records that you've had a really full diagnosis. You have irritable bowel syndrome, and it sounds like what we really need to do is focus on the management for both of you.
Well, that's what they tell me, but I don't know anymore what I have. I just know it's bad.
Okay. Well, let me understand a little bit about how it's affecting your life.
In the bathroom all the time, getting very stressed, can't do my work, can't take care of kids. My husband gets upset.
Never cooks.
I can't eat anyway, so I don't know what to cook anymore. So, it's been it's a nightmare.
Okay. Well, what's it been like for you?
Oh, well, I just feel like I don't have a helper, I don't have anybody to, help me with my problems, because I'm always having to focus on her or my kid. So I just feel like I'm shut out I just have to fend for myself. That's tough,
So you're feeling like it's all on you right now?
Well, yeah, because I'm not the only one who's healthy. Special needs kid, and then she's in the bathroom for 30 minutes, 40 minutes sometimes, and never has any energy, I don't like my life at all. Right
You got to be a little helpless in that situation with, you said special needs kid?
Yeah.
All right, so I'm making a judgment now that I'm assuming that this, we know from the record that this is irritable bowel syndrome and the focus on management, But what's really in my face now is his behavior, and I'm going to try to address this a little bit. I wouldn't normally do this, but he's so consuming in this interview that I need to give him some attention to see if I can get him to unfold his arms, basically, so we could deal with them as a couple. You said you had a special needs kid. What's that been like?
Well, it's tough because we didn't know, I mean, I'm not sure we knew what was going on, you know? I'm not sure we knew what was going on with him, and then, you know, the diagnosis was made, and he's very slow, and, you know, we have to do a lot of things for him, and he gets special attention at school. But I guess the thing is, it's like I have to work. One of us has to work.
Yeah, sure.
And I don't really have any extra money because she can't work. And I mean, you know, it's financially tight, so we're having to depend on some social service help for that. And it's embarrassing.
I understand. And how do you feel about this situation for yourself?
It's been going on for 2 years, Dr. Drossman. I am desperate. I want to get out of this situation. I want my life back. Some days I'm just in bed all day long.
How do you feel about he's feeling such a burden right now?
I feel
Does that make
bad.
you
I
feel
feel bad, but I don't think he sometimes understands how bad it is for me.
That's one of the big things is both feeling the burden and maybe feeling that the other person is not doing their share. Is that how you feel? In the way he addresses your illness?
I don't know anymore.
Well, I mean, you know, all these doctors haven't found anything. So I'm just, you know, maybe it's just in her head, you know.
Right.
And if that's it, she's just not living up to her end of the deal, you know. That hurts me because then, you know, I just don't know where we went wrong, you know, because we used to be a lot closer.
Well, I'm hearing not only the illness and not only working with the children, but the loss in your relationship as well. I mean, things were better at one time. Is that something you'd like to recapture?
Oh, I would. I mean, anything would be better than this. It's like living in hell.
Okay.
But you got to help me with the diarrhea somehow. Is there any medicine that you know what I've tried before? You saw my records. Is there anything you can give me?
Okay. So at this point, I think he's, almost ironically, he's gotten a little bit more of the message now than she has. And she's more focusing on this kind of, you've got to do something, this kind of helpless, passive kind of role. And a lot of expectation for me and a lot of what's called catastrophizing. Whereas now I feel I've kind of got him as a little bit of an ally in the sense that he seemed to respond well to the idea of kind of recapturing their relationship before. So they've grown into the situation that they've had these hardships, and instead of using each other for support, they've kind of blamed each other for it. My concern is how much can we go with this one. What was your name again?
Mrs. Smith.
Mrs.
Smith.
Smith. Okay. Mrs. Smith, how are we going to get this to a point where she's feeling satisfied and willing to work on this? Any thoughts at this point, how I might approach that?
I think as a clinician, much was focused in on the husband and the husband's needs, and I didn't get a redirect over to the patient because as I sit here and hear about the diarrhea and the pain, I know as a clinician, my first ideas are, you know, what am I missing anything here? Is anything been missed?
Sure.
And I think I got to redirect some more questioning of her about the symptoms before I can, you know, just assume that it's just ideas.
Right.
And I think she needs to hear that everything's been done, and try to, you know, redirect it and just reassure her that everything else has been done, this is what we can do. So I need to go back at the patient.
Yeah, exactly. That's how I saw it too, because in the dyadic situation, I actually focused on him, and then she's going to say, what about me? And this is being amplified by the fact that she may feel that all her life in recent years, she's not gotten any attention, and he's the one she's had to cater to or respond to. And in some ways, from a psychological standpoint, having an illness can have adaptive value in terms of getting his attention. Sometimes even negative attention is better than no attention at all. So now I think she needs her turn.
But I think by putting his guard down or a little bit of his frustration, he's more willing to listen now to her story.
Right.
Because I think that the issue is they both need to understand where the other one's from, their perspective.
Right. And as I said before, his behavior was so consuming to this interaction that I felt that had to be addressed first. Okay. So, well, it does sound like you've had this for a very long time, and it's really affected what you can do. You said you can't take care of things at home.
No,
What else?
I'm just down all the time.
Yeah. Tell me more about what you mean by down.
Sleeping, not wanting to get up in the morning. Basically, what I want to do is sleep it out.
Mm-hmm.
Sometimes I won't go to the bathroom for a few hours if I'm asleep, and that's all. I just want to be in bed. I don't want to talk to anybody, and when the kids are with him, that's the best time for me.
Okay, so I'm going to take a step back. I don't know if I was assuming that the workup is negative, but maybe I should go back now and say, have you had an evaluation for your GI problems?
Oh, I had a lot of tests, Dr. Drossman. I had 2 colonoscopies. I had, the endoscopy when they look in the mouth. Blood tests, x-rays. I had it all.
So you've had it all. So what's your understanding from all these tests and what the doctors have told you of what's going on?
Irritable bowel, that's what they tell me.
And what does that mean to you?
I don't know. It means I have pain and I have diarrhea and nobody knows how to help me. That's what it means.
Okay. So it sounds, let me just be clear about that. Are you worried that something's being missed, or are you concerned that you're not getting properly treated?
I just want help. I mean, I think with all these tests I had, probably nothing bad is there. But I need somebody to help me.
Okay. I'll be glad to continue to work with you on this. And I think from the records and from what you've told me, I'd rather hold back on any diagnostic studies right now, because from the evidence and the symptoms I've read about, I think we need to focus on management. And would that be helpful to you if we can get to a point where you could feel a little bit better in terms of your symptoms?
Yes, and there's some other, kind of embarrassing things that I can't really talk about, but they make things worse.
Okay, so, and he reacted, so I'm going to lead in the direction of the relationship and sexuality and things like that. So, well, maybe it is hard to talk about, and you certainly don't need to say everything. That you can say whatever you feel like saying. I'm wondering, so it's telling me she may want to say something while she's doing that, putting your lips to your mouth. Is there something in terms of the relationship I should understand better?
Well, it's been very difficult to be intimate because, I'm always in the bathroom. Sometimes I can't even, I don't know. It's just interfering with everything.
And this is affecting you as well, I'm sure.
Oh, yeah. It's like a wedge.
Do you think this is something that could be worked on if you were feeling better?
I can't see it right now. I hope so.
Well, it sounds like we're dealing with several things right now, and I'd be glad to continue to work with you on this. First, we have to see about getting your bowel symptoms under better control. And if I had more time in the interview, we would get into that, but I think we want to have some discussion now. It also sounds like this doesn't affect just one person. It affects both of you. In addition to that, it's affecting you in a very deeper way than just having symptoms. It's affected your life, both of you, the way you see yourself. And so I think we need to understand better how this has impacted on your relationship. What I've heard is that you had a very good relationship before, and I think that's something you'd like to get back to kind of work together on this. Okay, so now I have to understand why she crossed her arms and legs. My question is whether she wants to continue the relationship, but I don't know if I can get into that right now because of our time. And I also think that trying to make judgments, 1 minute, okay, the context of the discussion, they came to me for the GI symptoms. All this other stuff came out. We can't take all day, but at the same time, we have to at least identify the problems and find the proper context. So my recommendation would be to do counseling, both marital and decide about individual. But right now, it might be more to get an idea about the relationship because that's what came up first. So I'm wondering if we can continue to work on your management. I'm also wondering if you can begin to explore how you can get back to where you were. And I have a colleague who's a counselor, and I wonder if you'd be willing to talk with them and see how we can get both of your interests understood in a way that you could come to a good conclusion.
Both of us at the same time?
Well, yeah. In other words,
Like
this is
family counseling or something?
this would be counseling. I think this is a situation where neither of you are feeling, I'm feeling that neither of you are feeling properly heard or understood. And that would be the first step for both of you to have your time to talk about that in the presence of the other person.
What do you think?
Will you go?
Yeah, if we can work out somebody to take care of the kids, yeah, I'll go.
I'll take care of the kids. Give them a hand. Should we take a minute or two? Do you know the story that we filmed them 10 years ago? Yeah.